There is a trap built into Medicare Advantage. 33 million Americans have already walked into it. Most of them don't know it yet. The trap doesn't spring when you sign up. It springs the moment you get seriously sick. Medicare Advantage plans are sold with low premiums, $0 copays, and extra benefits like dental and vision. What they don't tell you is this. If you ever try to leave, most insurance companies in most states have the legal right to say no. In 47 states, if you are enrolled in Medicare Advantage and your health changes, private Medigap insurers can permanently deny you the supplemental coverage you would need to return to original Medicare. The window to leave without a fight closes 6 months after your 65th birthday. Most people don't know the window exists. I'm going to show you exactly how this works, who is doing it, and the one federal right you still have that almost nobody uses. 33 million Americans are currently enrolled in Medicare Advantage. That is more than half of everyone on Medicare in this country. Every year, millions more turn 65 and are steered toward these plans. The three largest players are Humana, UnitedHealthcare, and Aetna. Together, they control the majority of Medicare Advantage enrollment in the United States. The pitch they make is simple. 0 premiums. Vision, dental, and hearing coverage. Gym memberships. Everything under one card. What that pitch never includes is a documented legal mechanism established in 47 states that makes it extremely difficult to leave once your health declines. There is a Senate Finance Committee investigation that examined exactly this. I'll show you what they found. But first, let me explain the mechanism itself. Because once you understand how it works, you'll understand why the companies selling these plans work very hard to make sure you don't. If you are approaching 65 and have not yet chosen your Medicare coverage, what I'm about to show you changes that decision entirely. If you are already enrolled and something has changed in your health, there is still a federal right that may be open to you. I'll tell you exactly what that right is and how to use it before this video ends. And in a few minutes, I'm going to show you a specific federal document that Humana and UnitedHealthcare do not want discussed in the open. Here is how the lock works. When you turn 65 and activate Medicare, you enter what is called the Medigap open enrollment period. This window lasts 6 months. Medigap is the supplemental coverage that fills the gaps in original Medicare. The deductibles, the 20% coinsurance that Medicare leaves on your bill, the hospital coinsurance for extended stays. Without Medigap, a serious illness on original Medicare can cost you tens of thousands of dollars out of pocket. During your 6-month Medigap open enrollment period, every insurer in your state is legally required to sell you a Medigap policy. They cannot deny you. They cannot charge you more because of your health history. A cancer survivor, a diabetic, someone who had a heart attack at 62, during those 6 months, none of that matters. You have clean, guaranteed access to supplemental coverage. That window opens once, and then it closes. After it closes, 47 states allow Medigap insurers to use medical underwriting on anyone applying outside the window. Medical underwriting means they review your health history before agreeing to cover you. And they can say no based on what they find. Now, here is what often happens during that 6-month window. The person explaining your Medicare options is frequently a licensed insurance agent. That agent is paid a commission when you enroll in a Medicare Advantage plan. They are paid nothing when you choose only original Medicare plus a Medigap policy. The commission structure is not necessarily the agent's fault, but it is a financial incentive that shapes the conversation every time. What that means in practice is that the Medigap open enrollment period, the most important consumer protection in all of Medicare, is frequently never mentioned. Not because the agent doesn't know about it, because it doesn't lead to a sale. Here is where Medicare Advantage becomes the trap. When you enroll in a Medicare Advantage plan at 65, you are choosing private insurance to deliver your Medicare coverage. The plan replaces your original Medicare for day-to-day purposes. You trade the wide-open access of original Medicare, which covers any doctor or hospital that accepts Medicare nationwide, for a private network. In exchange, you get the lower premiums and the extra benefits. For most healthy 65-year-olds, this works fine for the first few years. The problem arrives when something goes wrong. Suppose you are 68. You have been on a Humana Medicare Advantage plan for 3 years. You are diagnosed with something serious. Your plan's network does not include the specialist your doctor recommends. The hospital where your surgeon operates is out of network. Every treatment your oncologist orders requires prior authorization from Humana. So you decide to leave. You want to return to original Medicare, where you can see any doctor in the country. To make that work financially, you need a Medigap policy to cover the gaps. You call a Medigap insurer. They ask about your health history. You disclose the diagnosis. No. You call another one. No. A third. No. This is the system functioning exactly as it was designed. And in a few minutes, I'm going to show you the Senate Finance Committee document that makes clear these outcomes were known and expected. Let me tell you about Linda. Linda is 67 years old, a retired school librarian from Knoxville, Tennessee. When Linda turned 65, a benefits counselor at her doctor's office explained her Medicare options. The counselor walked her through a Humana Medicare Advantage plan with a $0 monthly premium. It included dental coverage, vision, a gym membership benefit. Her Part B premium was already being deducted from her Social Security check. The Humana plan looked like getting something for nothing. She signed. 2 years went by without a significant problem. Then, in October of 2023, Linda's doctor found a lump, breast cancer, early stage, but requiring surgery and several weeks of follow-up radiation treatment. Linda's oncologist of 12 years was not in Humana's network. The hospital where her oncologist operated was not in Humana's network. The earliest available appointment with an in-network oncologist was 6 weeks out. Linda's daughter spent 4 hours on the phone requesting a network exception for the out-of-network oncologist. She documented every call, every representative's name, every stated reason. Humana denied the request. Linda and her daughter decided to move her back to original Medicare. On original Medicare, Linda could see her oncologist. No network restrictions. Any physician in the country who accepts Medicare. To make that affordable, she needed Medigap coverage to cover the cost sharing. They called a Medigap insurer. The insurer asked about her health history. Linda disclosed the cancer diagnosis. Denied. Second insurer. Denied. Third. Denied. Linda is not an unusual case. A 2022 Senate Finance Committee investigation found that Medicare Advantage enrollees with serious diagnoses face systematic, documented barriers when attempting to access out-of-network care. The report described denial rates for urgent out-of-network requests as significantly elevated compared to original Medicare for identical clinical conditions. The word they used was systematic, not occasional, not isolated, systematic. I'll tell you how Linda's situation was eventually resolved before this video ends. But first, you need to understand the financial reason why Humana and every other major Medicare Advantage insurer is structured to make leaving as difficult as possible. The financial logic is not hidden. Medicare pays each Medicare Advantage insurer a fixed monthly amount for every enrolled member. This payment comes directly from federal Medicare funds. It is called a capitation rate. Humana receives that capitation payment every month, whether your care costs $200 or $20,000. The less care Humana provides, the more of that monthly payment Humana keeps. That is the fundamental incentive structure of every Medicare Advantage plan in the country. Prior authorization is the primary tool for managing that ledger. When your doctor orders a treatment, Humana can require you to get their permission before the treatment proceeds. If Humana delays or denies that permission, the cost of the treatment never hits their ledger. The Senate Finance Committee investigation found that Medicare Advantage plans deny prior authorization requests at rates measurably higher than original Medicare for the same procedures and the same clinical situations. Senate staff reviewed individual denial letters. Many of those letters cited clinical criteria that independent physician reviewers found to be inapplicable to the specific patient's documented condition. And it gets worse. Medicare Advantage insurers have been found to systematically inflate patient risk scores to increase their capitation payments from the federal government. This is called upcoding. Insurers flag patients as having more severe conditions than their documented medical records support. A more severe risk score generates a higher monthly payment from Medicare. The Office of Inspector General has investigated this for over a decade. Their published audit findings show that the federal government has overpaid Medicare Advantage insurers by documented amounts in the tens of billions of dollars over the past decade. Humana, UnitedHealthcare, and Aetna have all appeared in Office of Inspector General audit findings related to inflated risk coding. The Department of Justice has active civil investigations into several of the largest Medicare Advantage insurers related to this practice. Those investigations are ongoing. While they proceed, those same insurers continue to enroll millions of new Medicare beneficiaries every year. Stay with me. What I'm about to show you next is from the specific Senate document these companies have worked to keep out of mainstream coverage. In October of 2022, the Senate Finance Committee released a formal investigation into Medicare Advantage practices. It ran 192 pages. Senator Ron Wyden led the investigation. The committee examined the 5 largest Medicare Advantage insurers. The findings were specific. Finding 1. Prior authorization denial rates for medically appropriate care were significantly elevated inside Medicare Advantage compared to original Medicare for identical diagnoses. The committee documented specific cases where Medicare Advantage plans denied services that the Centers for Medicare and Medicaid Services had already categorized as covered and appropriate. Finding 2. Provider directories published in plan marketing materials were materially inaccurate. The committee found that networks routinely listed physicians who had retired, who had never agreed to participate in the plan, or who were listed at practice addresses where they no longer worked. These are called ghost networks. You are sold a plan that lists your cardiologist as in-network. Your cardiologist has never heard of the plan. Finding 3. Appeals and grievance processes were systematically under-resourced. The committee found documented cases where appeal timelines extended past the point where the denied treatment was still medically viable. The treatment was denied, the appeal was eventually won, and the window for the treatment had closed. The Centers for Medicare and Medicaid Services proposed regulatory changes in response to this report. As of the time this video was recorded, enforcement has been inconsistent, and legal challenges from the insurance industry have slowed implementation of key provisions. Kaiser Family Foundation tracked Medicare Advantage complaint data through 2023. They found that consumer complaints about care access, provider availability, and prior authorization denials increased 22% year over year. The plans kept growing. The complaints grew with them. Here is the piece they're hoping you don't connect. The state regulations that allow Medigap insurers to deny applications based on health history outside the open enrollment period were written by state legislatures. State legislatures where insurance industry lobbying is among the most active and best funded in the country. 47 states allow medical underwriting for Medigap outside the open enrollment period. New York requires guaranteed issue for Medigap, regardless of when you apply and regardless of your health history. Connecticut and Massachusetts have similar protections. A small number of other states have limited guaranteed issue provisions. If you live in one of those states, you have options that Linda in Tennessee did not. If you don't, what I'm about to explain may be the most important thing you hear about your Medicare coverage. So what does this mean for you? If you are currently enrolled in Medicare Advantage and your health has changed, here is what you need to know. The first thing is called the Medicare Advantage trial right. Federal law gives every new Medicare Advantage enrollee a 12-month trial period. During those 12 months, if you decide you want to return to original Medicare, you have guaranteed issue rights for any Medigap policy available in your state. No medical underwriting. No review of your health history. The insurer is required by federal law to accept your application. Most Medicare Advantage sales materials do not mention this right. Most benefits counselors do not explain it. The Humana representative who processes your enrollment will not walk you through it. But it is real. It is written into federal Medicare regulations, and it has a clock. You have 12 months from the effective start date of your Medicare Advantage plan. If you enrolled in the last 12 months and something has changed, whether your health has shifted, your doctor left the network, or you are discovering the coverage is not what you were told, that window is still open. Contact Medicare directly at 1-800-MEDICARE. Tell them you want to disenroll from your Medicare Advantage plan and return to original Medicare. Then contact any Medigap insurer in your state. They cannot say no. That is the right Linda's daughter found after 2 days of reading federal Medicare enrollment documents. Linda had enrolled in her Humana plan 8 months before her diagnosis. She was still inside the trial window. They filed the disenrollment and the Medigap application the same week. Humana had to release her. The Medigap insurer had to accept her. She was back with her oncologist within 2 weeks. The second thing, guaranteed issue rights outside the 12-month window. Even after the trial period closes, federal law creates specific circumstances where Medigap insurers must accept you regardless of your health status. These are called guaranteed issue events. They apply if your Medicare Advantage plan is leaving your service area. They apply if your plan loses its Medicare certification. They apply if you permanently move out of your plan's geographic coverage area. They also apply if the plan engaged in material misrepresentation at enrollment. If a sales representative told you your doctor or hospital was in network and it was not, and you have documentation of that communication, you may have grounds to claim a misrepresentation. Document every call. Save every piece of marketing material you received when you enrolled. These rights require persistence to use, but they exist in federal law and have been successfully applied. The third thing is, specifically for anyone approaching 65 who has not yet signed, use your Medigap open enrollment period. You have 6 months starting from the first month in which both Medicare Part A and Part B are active. During those 6 months, every Medigap insurer in your state must accept your application. No questions about your health. After those 6 months close, you may not have clean access again in most states. Here is what to ask, specifically when you speak with any agent or counselor about your Medicare options. Ask them, what is my Medigap open enrollment period start date? Get the exact date. Write it down. Then ask, when does it close? That question, asked directly, gives you the window. And knowing the window tells you how much time you have to make a decision that may affect every year of coverage you have from this point forward. If a counselor cannot answer that question or tells you it doesn't matter right now, find a different advisor. If this is the kind of information you want to have, the information your insurance company is not going to put in a brochure, subscribe. Every week, I cover a different law, a different policy, or a different practice that the health insurance industry is counting on you not knowing about. Next, I'm looking at something that affects every American with health insurance, not only Medicare enrollees. It's about the out-of-pocket maximum. The number printed on your insurance card, the number you've been told is your worst-case annual ceiling. What most people do not know is that specific categories of cost, including some of the largest expenses that come with a serious hospitalization, do not count toward that number. Your insurer decides what counts, and I'm going to show you exactly how they've been making that decision. Insurance companies have spent decades building a Medicare coverage structure that is genuinely difficult to exit. Not because it has to be that way, because it is profitable for it to be that way. That is not a theory. It is documented in the Senate Finance Committee investigation. It is documented in Office of Inspector General audit reports. It is documented in year-over-year complaint data tracked by Kaiser Family Foundation. You now know something most people enrolled in Medicare Advantage do not. You know the Medigap window exists and when it closes. You know the 12-month trial right exists and how to use it. You know the guaranteed issue events that federal law recognizes. That knowledge does not change the structure of the system, but it changes what you can do inside it. Insurance companies maintain entire departments dedicated to the gap between what you believe you are covered for and what they are actually required to pay. You have the federal right to challenge every denial, every network restriction, every prior authorization delay. Most people enrolled in Medicare Advantage right now don't know that. Now you do.